Lupus is something that we consider as an autoimmune disease. And autoimmune is basically when we have our immune system that normally would fight off like things like germs or cancerous cells, however, in a normal person. But when you have an autoimmune disease such as lupus, this is when your immune system starts to fight against the cells in your body, and it can affect various organs. So basically, lupus is a systemic disease. It can affect various organs, and it's where your immune system is fighting against itself.
Our patients tend to present with some general symptoms like fevers, joint pains, anemia, and rashes. As a matter of fact, it is said lightly that any young female that presents with a rash, a fever, and joint pains is lupus until proven otherwise. So we may have our general tests done, and the patients may prove to have anemias, they may prove to have kidney dysfunction, and then again, based on suspicion, we go on to order the more specific tests, and these are our antibody tests. A general one would be what we call an ANA, and if that tends to be high, very high in patients with lupus, it can be elevated in other conditions as well.
Most commonly, I would say, based on our experience here in Guyana, it would be at the age of maybe late teens, so 18, 19, and early 20s and 30s.
So sometimes it can actually occur, or there can be a pattern of two peaks. Like there are some patients that present just after puberty or in that kind of age group, and then there's another peak somewhere in the middle age group between, say, 20 to 50 age group. So that's the pattern of distribution that has been found. And we have had patients that fit into that because we have some teenagers and then we have some more middle-aged women.
Lupus usually have periods of flares when the disease is really active, and then there is periods of remission. So the treatment that what we aim for is to have prolonged periods of remission so that they can live a normal life. However, when there is flares, there are certain treatments that we will give. So to prevent flares, as I mentioned, it would be hydroxychloroquine would be one of the medications once they tolerate it. And then if they're having a severe flare, there is something called prednisone, which is people know it as a steroid. It is a corticosteroid. It basically tries to suppress the immune system that is very active. It's very good in preventing flares, but there's also a lot of side effects that's associated with it when you're on it for a long period of time.
So if you are experiencing symptoms that you feel might be lupus or anything that makes you ill, ensure that you see a doctor. It can be the doctor in your neighborhood. There are clinics in almost every neighborhood. Ensure that you see a doctor. If you're with a private practitioner, ensure that you let them know what's happening. And then, if your doctor doesn't know, you can let them know that they can refer you to the rheumatology clinic at the Georgetown Hospital. This is a clinic that is a part of the internal medicine clinic.